Welcome back, everyone. If you are new here, hit that subscribe because today's topic is going to be fun, a little bit borderline controversial. We're going to spark up a little bit of fire here, and I could have not thought about bringing on a better guest and my good friend, Mitch. He's going to help me navigate these very important topics that everyone's talking about, that you should be talking about, and that we're going to be talking about. And I'm very excited about this. Once again, if you're new here, hit that subscribe button because we're going to be embarking on fun topics. Mitch, wonderful to have you on board as
thanks
usual.
Thanks for having me.
What's new?
You know, it's new year, right? New year. So,
recalibrating yourself.
Goal setting.
Yeah.
It's really cold. Detroit Lions lost in the playoffs, so that was terrible. And then outside that, snowboarding.
Yeah.
That's basically all I got.
Trying to restructure the year ahead.
Yeah.
You know, with the year ahead, with 2025 now in full force, we're going to talk about some of the hottest topics of 2025.
Okay.
We're going to be talking about some controversial ones like WHO and you're probably like, who's who?
Yeah,
we're talking about the World Health Organization.
Okay.
And America possibly withdrawing from it. We're gonna go there today.
Okay.
We're also gonna talk about Nico Avocado, and it is not a dish. It is a person. We're gonna be talking about this person. And we're also gonna be talking about burnout, clinic owners and burnout, and how this is impacting people and just really addressing it and trying to find some solutions around it. So these are some of the topics we're going to talk about, but let's start with the hottest topic right now.
Okay.
And that is the America's possible withdrawal from the World Health Organization. And we're going to be talking about your opinion on it, my opinion on it, what people should be thinking about, what people should be considering. It is a controversial topic. The new administration it's a new year, new administration. We're not going to go into politics because all the trolls out there are going to throw a lot of hate. This is a peaceful channel. We're Switzerland. We're here to create peace, to have great conversations. Okay. So, but we do want to poke at the bear. We do want to talk about this. So, Mitch, the World Health Organization, are you familiar?
A little bit.
Yeah.
I wouldn't say I'm well-versed in the area, but a little bit.
Well, for those of you that are much like Mitch, and even me prior to kind of getting really understanding of this topic, the World Health Organization is a conglomerate of a bunch of countries that have basically come together to help health be better in the entire world. Very simple. I mean, it's obvious, right? However, they have collaborated together to kind of tackle disease, to figure out initiatives, to figure out how to vaccinate against the new diseases out there, to really overcome the global health challenges that the earth is facing. And the United States is part of this organization. Okay. And as such, the new administration and the new initiative that's being placed is America withdrawing from this organization, saying we don't want to be a part of it anymore. So in terms of this, in kind of, what knowledge you have and what have I displayed to you so far, what are your initial thoughts or what are your initial curiosities?
Yeah, I think my first curiosity is, what is the reason to withdraw?
Sure.
Like, what is that? I don't know.
Yeah. So, that's a great question. And I think that this is where a lot of the controversy comes from.
Okay.
Is that, yes, the United States is a global leader in many things, in the economy, and of course, health, and just a lot of different initiatives around the world. And the World Health Organization and United States contribution to it is heavy when it comes to financially.
Okay.
So the big push with the current administration or the new administration is that we have traditionally spent a lot of money contributing to this organization that supports the entire globe. Just to give some perspective, China, as a result, not to pick on China, but this is coming straight from the White House. China is significantly higher in population. We know that. 300% or 300 times, I forgot what it is, more populous than the United States. Yet, the U.S. pays 90% more than China to the World Health Organization. So we as in the United States, is supporting a significant amount of money in comparison to the other members of this organization. So a big part of it's just spending. Why is the United States spending so much money when you have these big dog nations that aren't spending as much? Why should we be spending? Why should our money and our tax dollars and our hard-earned money as a complete country should be going to supporting the entire world? Now, yes, we are a global leader. That has been our place. But that's kind of the whole thing. That's one of the reasons, is that. Other reasons are because of post-COVID era. The post-COVID era showed that the United States was obviously working very hard to create vaccines, and so was the rest of the world, right? I think everyone globally was doing their part. But the United States took a lot of burden and it took a lot of initiative. And that is really where a lot of the frustration loomed and started to generate, and that fire was sparked. And so this is kind of where, to my knowledge, I'm not an expert on this, but from what I'm learning, this is kind of the reasoning for that. And the big question is not our opinion on it, but how is that going to impact healthcare in the United States? How is that going to impact medical providers, if it is at all? What are your sort of thoughts on the global changes that are going to be sort of manifesting, and how that's going to fall back down to our day-to-day clinics and hospital workers and providers? Is it going to hurt or help them?
Yeah, well, yeah. So basically, from what I'm hearing, it sounds like the World Health Organization is noble in purpose, right? We're trying to help the whole world.
Yeah.
Let's work together, all the countries. That sounds like a great idea. I think the only concern I would have on something like that is when, and you just see this in other areas of like life and business, is when you have one organization that probably deems what everything should be done as, then I think that takes away from like innovation in healthcare.
I agree.
Because then it's like, oh, but we can't do that because they make the decision, right?
Sure.
And I think, in business, you don't want monopolies, right? You want competition, because then you get innovation, you get new products, you get new services.
True.
So I think from a healthcare standpoint, it would make more sense to have it to where you have, I guess, more competition, more opinions. That would seem important to me. And then as far as, I guess, from the U.S. wanting to withdraw, well, if the U.S. is spending, 10 times as much more compared to other countries, that's just not a good deal.
Sure.
So I think if they are going to stay in it, maybe restructure it kind of like an electoral style where, hey, your population percentage, this is what you would contribute based on your GDP, based on this, versus like one country pays what 5 countries would pay.
I like that.
So I think if you just ration out the investment from every country a little differently. Yeah, we do the same thing with like U.S. politics. We have the Electoral College because not every state is as large as California, right? So we need representation from each state that's fair to the size of that population. So maybe if they were to stay there, probably something along that lines.
Sure,
but if our tax dollars are paying for everyone else, there's a lot of problems we have in our country.
That's the thing. I think that we're kind of just cleaning up in-house, right? Let's focus on the homeland. Let's kind of repair healthcare here. Let's make healthcare as big as it can be. Let's protect our citizens. Not that we want to neglect the rest of the world. It's let's focus on home, so that way we can help focus on the rest of the world too. And I agree. You got my vote. If you're running for politics, you got my vote. I love what you said about, hey, that's not a good deal. Let's renegotiate here. Let's figure out how to make this advantageous for the entire world, but also advantageous to where the U.S. isn't paying for everyone else and for higher populations. I love that. Let's shift our focus a little bit. Let's go to a little bit of a fun topic, something that I recently, and the reason I have my phone out is so I make sure I don't butcher this gentleman's name, and that is Nico Avocado. Is it a fruit? Is it a vegetable? Avocado? That's another topic I want to talk about.
It's a fun name.
But Nico Avocado, let's put an image of this guy or a video of this guy so we can make sure that this well-known influencer is seen. Nico Avocado, he's this well-known influencer, and apparently he, does videos of him eating ridiculous amounts of food and all this kind of stuff. I have my own opinions on that. But he had a lot of weight issues as a result. He had very great weight loss journey. He's lost a lot of weight. And as a result of losing weight, he is now kind of considering plastic surgery. He's considering doing procedures because after weight loss, you're dealing with a lot of things. And the question is, should he consider plastic surgery as an influencer? Is that a positive influence? Is that a bad influence? Should he be influencing in that manner? Are there alternatives to plastic surgery because he organically lost all this weight? Or I'm not quite sure how he lost all the weight, but he lost all the weight. So the question is plastic surgery necessary? Is there something else he can do? Maybe a non-invasive technology? when we see these influencers, they hold a lot of power. The power of influence, the power of, having people understand that, hey, this is something I can do, and then everyone else does it. Influence is positive and negative.
Yeah.
Do you think that this is a positive influence or a negative one? And what are your opinions on surgery, if you should do it, or non-invasive, if you should do it, or?
Yeah. Is there a photo of his before and after? So
there is.
Okay.
I'm going to show you this guy, and I think that the crazy thing is he doesn't look like the same person, which is what's nuts. And I think that with that being said, you can see here that's kind of his transformation.
Yeah,
crazy.
That's a good amount of weight loss.
Yeah, and
he needed that.
He needed that.
Yeah,
he needed that for his health. He needed that
for sure.
Right, and I think that it's great. I'm proud of him from what I know. Right, I don't know this guy, but proud of him for losing weight. And I think that's a positive influence. But now we're going into the cosmetic arena. Right?
Okay.
Is he going to do plastic surgery? Should he do plastic surgery? And kind of that.
Yeah, I think when it comes to plastic surgery, it depends on what his goals are, right? And what he's comfortable with for himself. And so with that kind of weight loss, you're probably looking at shelving of skin.
Yep.
And so when you think about it, maybe from his perspective or maybe someone else's perspective, if you lose a ton of weight, you do it because you want to feel confident. You want to feel strong. You want to feel like, okay, I'm healthy. But then sometimes you'll have that nagging reminder, and then you still don't feel confident. You still don't want to go to the beach. So I think that's perfectly healthy. That if you have like shelving of skin and you want to feel like, okay, I'm confident in that, I totally get that, right? I mean, if I had that, I'd probably want to do it.
Yeah.
But as far as like from an influence perspective, whether or not plastic surgery is good or bad, I mean, there's a lot of surgeries that can be good or bad. If you have a deviated septum and you have a hard time breathing, it's like, hey, it's kind of needed. Why? Because it makes you feel better, and then you feel more confident.
Right.
And so, I think it's totally fine. But I think if you're just I think there's an area that you kind of go too far with plastic surgery where now we're just making a lot of things very artificial, but I think if you want to tune things, tone things up, or, same thing with like a rhinoplasty. You have, a lot of times rhinoplasty is great for breathing just because your nose isn't the way you need it to be. And so if you can have it tuned and shaped to the way that you need it, I think that's fantastic.
Yeah, I agree with you. I think that plastic surgery for Nico Avocado seems quite necessary for his desire. He wants to lose weight, which he has. He wants to, of course, now treat these underlying other issues like the sagging of skin. He probably has stretch marks he might be dealing with. There's going to be a lot of other things, and I think plastic surgery is great. I do think that there's going to be a place for non-invasive technology. I don't think it's a this or that.
Yeah.
I think it's going to be both, right? As you and I both know, it's a combination of everything. There's no one thing that fixes all. You need a medical weight loss journey. You might need plastic surgery. You might need non-invasive care or minimally invasive care with technology. You might need hormone replacement therapy. You might need, muscle technology. He's probably going to need all of it. And I think that's totally okay. I think if he's influencing in that manner of, hey, listen, I've had a restorative change and this is how I got there, that's educating people of saying, listen, I did it, so can you. I did plastic surgery to get rid of this loose skin. I did radiofrequency microneedling to get rid of the scar tissue. I did all this, so can you. I support it if that's the initiative that he's taking, and I look forward to seeing his journey. So, no, I appreciate that. We're going to move to a new topic. You're going to love this one, Mitch.
Okay.
Because this is very much up your alley, and it brings us to a more practical discussion.
Okay.
For clinic owners, really. And that discussion is, how can you ensure your front desk is maximizing consultation conversions? Not physically, like how do we train them? You and I, more so talk about how to, but more so this. Do clinics know that their front desk consultation, or do they know their consultation conversion rates? And if not, how should they track it? Because we talk about, you and I talk so much about the importance of the receptionist role, how they are so important as the first impression, making a good one, but ultimately doing their job to get a consultation booked. That's theory. And that we know is base minimum.
Yeah.
But how do they track it? How should they track it? Are they tracking it? Do you think clinics are tracking that? And do you think they should?
No, they're not.
They're not tracking it.
No, most clinics aren't tracking that. I mean, a lot of clinics track how many consults do we have booked today, and then how many purchased. Great. I mean,
Sure.
That's obviously what you want, but if you don't have marketing to reception to consult, it's like, but yeah, they're not. I think, and you'll appreciate this in medicine, right? Like if you don't measure it, it doesn't matter.
Right. So true.
So
data matters.
Yeah, and you have to measure it, and then when you have a number on it, then you can, hey, talk to your receptionist and go, hey, what's going on? Where's the conversion at? Okay, where's our missed opportunity? What's going on? I think first and foremost, what's the next question? How to track it?
Yeah, how to track it.
So how to track it? I mean, if you have a great CRM, it will track it, right?
Right.
And so if you have good technology, and that's why software is fantastic. And but I mean, not every provider has that. You have a lot of different costs. You have team costs, you have marketing costs and product costs, treatment costs, consumable costs. Then you just buy groceries for your own house, right?
Yeah.
So then you're like, last thing I want to do is buy more stuff for the business. And so you could just go old school, right? Pen to paper.
That's what
get
we
an
did.
Excel sheet.
Yep.
Yeah. Hey,
Track
we got
how
10
many
calls today.
Yep.
What were the 10 calls? 6 inquiries, 4 post-op patients. Okay, cool. What happened post-op? Okay, so we actually had 6 real calls. Okay, how many of those converted? Okay, 1. 1 out of 6. That's very poor, right? What are we doing?
Exactly.
So
that's the big thing, is that so many people do not know their numbers. They don't know their financials. That's one thing, but they don't even know step 1. How many calls am I getting and how many am I converting? If you don't know that number, you have no handle on your business.
No.
That's like not understanding how much income to expense ratio you have. How can you not, right? This is where your income is made, isn't that first step? Mm-hmm. So to your point, go old school. Have reports made. Have your receptionist log how many calls did I take today? How many of them converted to a consultation?
Yeah.
How many did not? And if that number is not improving, we need to train that person better or replace them. At the end of the day, we have to understand what the business needs are. And if you don't know your data, if you don't know your performance, think about athletes. They track their performance. If they're shooting free throws, they have a free throw percentage. If they're shooting 3-point shots, they have a 3-point percentage. Or anything for any sport, it's based off of data, and that's how they know how to improve.
It's true.
We're playing a game here. Owning a clinic is a sport. Being an entrepreneur is a sport. And if you don't have data to back up your performance, how are you improving?
Well, and another thing, from a leadership standpoint, if conversions aren't there, then you can talk to your team member and go, hey, what's going on? Right. Maybe
accountability.
Maybe like they're just sad that week. Maybe like it sounds, sad story, but maybe their dog just died and they're at work and it's like,
we can have understanding.
So then as a, leader of your team, you could be like, hey, maybe you should take a day or 2 off and not answer these phones. Right.
Yeah.
And so, but it allows you to figure out, okay, is it a confidence thing? Is there something going on in their personal life? What can I do as a leader to serve my team member?
Right.
But then it's like, okay, as the leader of your team, you go, well, I gave you a system. I trained you. We have a way to measure it. We've supported you, and then now they don't do good. Well, then now you have your answer. Okay, maybe we need to replace that role. Right. And then, okay, can we use this person in another area of the business, or does this not going to work out?
Right.
But if you don't measure it, it doesn't matter.
Without data, you can't make decisions. So very important. And you mentioned something earlier too, like, is this person just needing a day off? Are they burnt out? And that actually brings me to my next and last question. I'm going to read it here.
Okay.
And it's this big one. And, it's funny because it's a topic that I feel like I need to be more involved in because I feel this as well. And it's, we can't optimize clinic operations unless we tackle another big challenge, which is clinic owner burnout. When they're so burnt out, when clinic owners are just working tirelessly to generate all the income, they don't have the mental capacity to figure out data, to figure out operations, because they're just so tired themselves. Mm-hmm. And so we have to understand and really talk about this question of burnout is reality right now for all clinic owners. And the first step of a clinic owner addressing burnout is to regain their freedom. I mean, what are your thoughts about this?
Yeah, well, burnout is definitely real. I've experienced it. I mean, I'm not a clinic owner, but
everyone feels
when I did professional sales and, you know, capital equipment sales, and you're in your car from 7:30 a.m. to, you know, sometimes 7 at night, and then you're stopping in a bunch of medical clinics, you're making cold calls, and then sales aren't happening, or they are, and you're like, okay, this is great. It gets tough. Yep. And then you go home, then your dad, and then you gotta, you know, make dinner, and then you're like, I haven't worked out, and
Right.
I ate that cookie at the coffee shop, right?
Yep.
And so you just get stressed out. It gets a lot. So from my perspective, is figuring out, first, take a step back. I think you just need like 2 days, reset, kind of like turn the phone off, get your head right, get in a neutral headspace. That way you can analyze everything. Right. Then go, what am I wasting time on that doesn't generate revenue? Yeah. Right? So then simplify or find a way to buy back your time and streamline a process. I mean, we do this all the time, right? We'll look at our stuff and go, okay, we got to make this more efficient. Yep. And I think starting practically there. And then a lot of times, I think there's two other aspects. One, biology, right? I mean, are you eating junk? Are you getting poor sleep? It seems cheesy, but it's not, right? I mean,
so true.
Did you get cocktails on Wednesday night and then show up to work the next day? And it's like, well, you're hungover, right? You're tired. How do you expect to be performing your best? Yep. So I think just learning how your body operates, what causes brain fog, what causes you to lose focus. Everyone's different. And Sam, I'm not telling you to go do like cold plunges right now, even though those are great. But I think it's figuring out what works for you. Yep. And then the second part is more of a philosophy, having just a good attitude. You want to look at abundance mindset, right? And a lot of times when things aren't going your way, you start to freak out and you're like, oh, no. Hey, it's okay.
Right.
We have the rest of it today. We'll have tomorrow. We'll be good. Yep. And just having that opportunity, abundance mindset, and just having the right attitude really goes a long way. I've been fortunate enough that that's helped me, just having the right attitude. But I think from your perspective, as being the actual, you know, owner of a medical clinic, how did you handle that?
That's a great question. And I think that one of the things I learned very quickly is that we can't do everything, and we want to, right? I think when you go through medical school and you go through your advanced training and all these people that we meet all the time, the world revolves around them in their place of work. You know, a surgeon, they're the talent. Not that the nurses and supporting staff aren't, but without the surgeon, surgery doesn't get done. And there's a lot of immense pressure on them, not only doing the procedures, getting the job done, but also racking in all the revenue. And what that sort of trains is a lone wolf mentality. I have to do everything. I have to generate all the income. I, me. And that's why a lot of sort of the negative connotations that associate with medical providers is there, right? They're narcissists, they're arrogant and all that. And to, you know, not everyone is like that, but a lot of them have that sort of persona. And that's because of this. It's because they're used to studying on their own, getting through board exams on their own, interviewing on their own, making it out on their own. And of course, supporting all the revenue on their own. And what I realize is that those days have evolved. You can now delegate tasks to other team members. You can delegate other revenue sources. If you have a nurse, you can bring on a service that generates high amounts of revenue that the nurse can do. If you have an esthetician or a medical assistant, you can bring on technology and services that is delegatable to them. So now we have to understand, should I make investments in other people by either hiring them or training them, or should I make investments in equipment or technology that produces results for patients, provides a service for a concern, but also provides you to not have to generate that income? That's why I invested in technology in our practices. We bought body technology, we bought skin technology, face technology, laser technology. We brought these on, and it's not fun to purchase these things. You know, it's hundreds of thousands of dollars. Yeah. But those hundreds of thousands of dollars buy us freedom. Yeah. They buy us the ability for other people to generate income, so that way we're not the ones having to grind it out. And that opportunity exists today. 10, 15 years ago, these technologies didn't exist to the way that they do now. So those options weren't there. Delegation wasn't as prominent. Today it is. And if you're a healthcare provider, if you're a surgeon, if you're a dentist, if you're a chiropractor, if you're any of these professions, there are choices. do what you love, but you don't have to be married to your occupation until you're 75, unless you really love it. Great, good for you. But if you want to be able to buy back your time, as you call it, if you want to be able to diversify your income, diversify your mindset. Yeah. Bring on new team members, delegate them tasks, and take that burden away from you. Yeah. Delegation is hard because it's so hard to trust people. And my biggest advice is don't try to find someone who's as passionate as you. You will never find them. No one will be as passionate as you. But if you can find someone that's 75% passionate as you, that's pretty good. Or if you get two people that come together and they equate to your passion, hey, that's amazing. The biggest entrepreneur curse or physician curse is that they try to find someone that's just like them. Not going to happen. Try to find people that have a fraction of the percentage of your passion and show them the vision, delegate it to them, and they will carry it on. You're a good example of it. Fantastic example of it. I gave you a vision. I said, hey, I need help here. You're really good at it. You have more than, brought it up to our standards. And that has given me breathing room. That has given me ability to go focus on other passions, grow other opportunities while giving other people opportunities. And I think that's the biggest thing is delegation. And it's so hard. Right? It's easier said than done. But it is something that I think every entrepreneur, but more so every healthcare provider and physician needs to learn.
Yeah, I would agree. And I appreciate that. I'm glad I give you,
it's you invest in things such as your education, but you also have to invest in other avenues of success. And that's not always revolving around you as a human. Maybe it's investing in other humans, investing in technology, those sort of things. And the other thing is that you mentioned one thing, which really resonates with me because I need to do better at this. This year, I am trying to do better at this. And that's taking care of yourself, eating better, resting, recharging. And we have to understand that if you think about, I love watching Formula One racing. And if you see how they take care of those vehicles, it's ridiculous, right? I mean, these cars are really, any racing, not just Formula One. But those machines, that's what they are. They're machines that are very fast. They take care of them so well because if you don't, you won't win a race or you'll get into a catastrophic accident. Ugh. Our bodies are no different. If we want to win the race of life, if we want to win our businesses and win every single opportunity that we have in the clinic or any entrepreneur activity you have to take care of your machine, which is what? Your body, your mind, and your body. If you don't take care of those two things, how are you going to win at life? This is our machine. Yeah. And we have to take care of it. We have to take care of it with proper sleep. We have to take care of it with proper eating, taking a day off, you don't have to take, weeks and weeks off at a time. If you can, great. Yeah. That one simple day of recharging allows you to take care of your machine so your machine can go back to work and win. And that's the mindset, is we have to take care of the vessel that we have, and that's our body.
Well, and I agree with that. And I love I love that analogy, just like making it to the machine. And I think there's also a consequence to not doing it. Right. Which when like you kind of talk about surgeons, like, okay, it's me, I have to do everything, it's me. It's like, it's not. You have your team, you have your friends, you have your family. And when you're stressed out, you're burnt out, that energy pours onto the people around you. Yep. When I would have my burnout days, man, my wife was like, you stink. I don't like you today. Right. And then my kids don't get my full presence. And so when you don't have the discipline, take care of yourself and make sure your head's right, that pours into everything else, which then just adds on to the stress and it's that vicious cycle. And so it's really important, right? How are you serving the people around you? Yeah. So,
well, Mitch, I appreciate this conversation, and it was a very diverse one. And I think that we don't have all the answers, but I feel like we have opinions, and more so than our opinions are your opinions. And I want to make sure that all of you listening and all of you that have engaged in our audience and all of you that are yet to subscribe, come on, hit that subscribe button. I want to hear from you. I want to hear constructive conversations about the World Health Organization and your opinion on the United States presence, either remaining or withdrawing from that. I want to hear about Nico Avocado, your opinion on his sort of journey of weight loss and possible plastic surgery and non-invasive care. And I want to hear your opinions on the other topics that we talked about, like burnout and front desk conversion, how you're tracking. If you're a clinic and you have a great way of tracking your sort of front desk conversion rates, post it down, share your knowledge. Let's help each other out. Let's figure out how to make in this industry better. Let's make sure that we are working together to make the world better, to make this sort of initiative of health, entrepreneurship, and most importantly, patient care better. We hope that you can provide some context and provide your opinion. Make a comment below. We appreciate you joining us, Mitch. I appreciate you being here.
Thanks for having me.
Looking forward to the next conversation. We will talk to you guys real soon.